guys, my name is Natasha and I'll be explaining about typhoid fever. So typhoid fever is a bacterial infection that could lead to fever, diarrhea and vomiting. Typhoid fever could be fatal and it was caused by Salmonella Typhi bacteria. The infection of typhoid fever often pass on through contamination, food or drinking water, and it is more prevalent in places which is less frequent in washing hands. It can also be passed on by carriers who do not know that they are carrying the bacteria inside their body. For example, Mary Malone, who was a cook. She was also known as Typhoid Mary, where she cooks for people in America, and then most of the people who consume her food was infected with typhoid, although they never know what's the real cause of it. So after a checkup and all, it was confirmed that she was a carrier for typhoid fever, and she has been quarantined and stopped from cooking for others. And typhoid fever is an infection which mostly lives in our intestine and the bloodstream of our body. And so far, there was no animals that was proven that have been carrying this disease. So the transmission of typhoid fever is often always from humans to humans. Thank you.
My name is Nurza Dusada, so I'm going to continue with the epidemiology of typhoid fever. 2012, the study was conducted by a researcher to know what is the population of the typhoid fever in the Kelantan. It showed that 1,932 patients were admitted into the various hospitals in the Kelantan. This is due to the infection of typhoid fever. Okay. Actually, typhoid fever is caused by Salmonella Typhi, where all of the patients develop ingestion of food or water that is contaminated with the Salmonella Typhi. In 2005, there is an outbreak of typhoid fever. However, between 2008 and 2010, there were decreasing of incident typhoid fever from 14.7 cases to 2.8 cases. 100,000 population. We know typhoid fever actually caused by poor environmental sanitation, low success rate identification of the carrier, which is Salmonella Typhi, and unhygiene food handling. This is why the worker who are involved with the food handling was asked to take food vaccine, which is typhoid vaccine. At the end of the study, the results showed that Kelantan is the endemic area that is full of typhoid fever, where population at that time showed that the incidence of these cases peaked at the year of the 1998 and 1999, where the focus of the patients that were developed the typhoid fever is more to children compared to the adults.
My name is Raja Nurhazida. Typhoid fever is caused by contaminated food and drink that contain Salmonella Typhi. The bacteria Salmonella penetrate ileal mucosa, reach mesenteric lymph nodes via lymphatics, multiply, invade bloodstream via thoracic duct. In 7 to 10 days, through bloodstream, they infect liver, gallbladder, spleen, kidney, bone marrow, and after multiplication, bacilli pass into blood, causing secondary and heavier bacteremia.
These factors of typhoid fever include poor hygiene, poor sanitation, and also by traveling to endemic areas with people who are infected with typhoid fever.
This is Sudan Anaiko. I will be tell you about signs and symptoms of typhoid fever. First, cold appetite, lethargy, diarrhea, and headache. Body temperature above 38 degrees Celsius. Heart rate low, spleen and liver swelling, rest on our skin.
My name is Noraziti binti Omar. Do you guys know about the treatment of typhoid fever? Okay, the treatment of typhoid fever is antibiotic. Antibiotic that can kill the Salmonella bacteria can treat the typhoid fever. Prior to the use of antibiotic and intravenous fluid, the fatality rate was 20%. Antibiotic antibiotic and supportive care have reduced the mortality rate to 1 until 2%. With the appropriate antibiotic therapy, there is usually improvement within 1 to 2 days and recovery within 7 to 10 days. Antibiotic that effective: chloramphenicol, ciprofloxacin, cetrizone, ampicillin, trimethoprim. Other than vaccine, what we can do to prevent typhoid fever is avoid drink untreated water. Wash your hand with soapy water is the best way to control the infection of typhoid fever.
For our video. So from what you have known from what my friends have mentioned, we know that typhoid fever is a very common cases in Malaysia as well as worldwide. Typhoid fever is very important and it's very crucial for us to know whether the places that we've been to, the places that where we go eat to is clean or not. So whenever we feel like we having fever, diarrhea, or some other symptoms of typhoid fever, we need to regularly check up with the doctors and ask how to take the vaccine and ask how much will it cost if you want to take the vaccine. So based on our study in Kelantan, which was in Kelantan, the outbreak was due to poor sanitation and was due to poor follow-up in managing the typhoid cases. So in order to prevent this from occurring again, the government as well as us, we need to work harder to increase our sanitation and try to keep ourselves regularly checked up with the doctors. Thank you.
I'm all thinking